Greetings and welcome to the Michigan Department of Environmental Quality Pharmaceutical Waste tutorial recorded in September of 2012. My name is Christine Grossman. I'm the waste specialist in the Office of Environmental Assistance. I help people on a day-to-day basis get answers to questions on Michigan's environmental waste regulations. I work in the Environmental Assistance Center. This is where people can call Monday through Friday, 8 to 4:30 to get answers to environmental questions. I work with a team of specialists who can answer most questions related to DEQ matters, or if they need to, direct you to staff that can. Our center is housed in the Office of Environmental Assistance, or the non-regulatory arm of the department. Since we're non-regulatory, you don't have to be concerned about increased oversight from contacting the DEQ. So if you've got questions or any concerns related to the information provided in this tutorial, I highly encourage you to contact us for help. That's what we're here for. Today, we're going to cover why there's an increased concern about pharmaceuticals in the environment, a simple way to manage drug waste to meet the environmental disposal regulations, the preferred disposal method for pharmaceuticals because it has the least impact on water resources, and lastly, how to find compliance assistance and pollution prevention resources designed specifically for healthcare. I'm guessing you're probably asking why we've come to be more concerned about pharmaceuticals in the environment. Basically, our concern has heightened over recent years because we now know that many pharmaceuticals are persistent in the environment. We first detected them in surface waters and groundwater sometime in the 1970s, and through continued testing over the past 30 years, we've come to learn that pharmaceuticals generally don't break down in the environment. Instead, they remain intact and cycle through our water resources, and in fact, most streams, lakes, and groundwater tested across the U.S. have shown low levels of pharmaceuticals remaining in the water. This is particularly concerning given this is the same water resource that we use for our drinking water. We've seen materials like sleep aids, blood pressure meds, birth control, antidepressants, and various other medications detected. Currently, the U.S. EPA continues to study the matter, looking for a grander scale course of action. So what we're doing today is discussing ways to collectively make a difference to help minimize our pharmaceutical footprint in healthcare. As you likely know as a medical professional, most medications that we take aren't absorbed by our body. Most of them are excreted and end up in our wastewater system, but our wastewater systems are not equipped to remove the drugs or pharmaceuticals. So there's a large, sizable contribution of pharmaceuticals in our water from use. And then we have another chunk of prescriptions that go unused for various reasons and sometimes make it to our waters. What we're looking to do today is help you understand how you can easily help prevent pharmaceuticals from getting to our water resources. Fortunately, there aren't any known health effects or risks to people at the low levels that we've detected in the water. However, absent improvements in our disposal or our wastewater treatment, we expect that the level of pharmaceuticals in our water will continue to rise from an increasing population using more medications. Some studies have shown impacts to fish and wildlife. Fish have been found to be feminized and no longer exhibiting all the male anatomy they should, and that's expected to be caused by exposure to low levels of estrogens in the water. Nonetheless, due to this growing body of evidence showing that there's pharmaceutical pollution in our water, pharmaceutical pollution is coming under greater scrutiny. Because of all this, we are reaching out to educate healthcare professionals on the existing waste regulations and trying to also ready everyone for regulatory changes down the road. At this point, you're probably asking if healthcare providers really need to know all this, and ultimately they do. They need to know all of this because the waste regulations were written broadly. They apply to all businesses, including hospitals and medical care and veterinary clinics. They don't just apply to manufacturing. To comply with the waste regulations, healthcare providers need to evaluate each drug at each dosage to determine what type of waste they have. Is it a hazardous waste, liquid industrial waste, or non-hazardous solid waste? Then they need to determine the total weight of all hazardous waste generated monthly, and from that, they determine their legal disposal options. The more hazardous waste a site generates, the more regulatory obligations they have. Some drugs, when destined for disposal, are subject to hazardous waste regulation. Others are subject to liquid industrial waste regulation, while still others are subject to non-hazardous solid waste regulation. Each waste type has its own unique set of handling and disposal requirements. This slide just shows an overview of the waste characterization process. If you have a waste, you have to first look to see if it's a hazardous waste. Is it listed on lists in the rules, or does it exhibit a characteristic of being ignitable, corrosive, reactive, or toxic that makes it a hazardous waste? If it does and it's not excluded from hazardous waste regulation, it's subject. If it is excluded from hazardous waste regulation, you then look to see if it has free liquids. If it's got free liquids and it's not excluded from liquid industrial waste regulation, it's subject. And if it's excluded from hazardous and liquid industrial waste regulation, then it's going to be subject to non-hazardous solid waste regulation if it's a waste. To put things into perspective, approximately 15% of a pharmacy's inventory meets the definition of hazardous waste. Beyond that, there are many medications that come in liquid form, and only sites with records that prove they are exempt from hazardous waste regulation or are a conditionally exempt small quantity generator can manage waste that meets the definition of hazardous waste under less strict standards, and that's assuming they can find a non-hazardous disposal facility that will take them. To be sure it's clear, I wanted to highlight that we're only talking about pharmaceuticals here, or only drugs, medications that are used to treat, diagnose, cure, and prevent human or animal ailments. We're not talking about infectious medical waste like needles, blood, body fluids, or organs. Medical waste is subject to completely different handling and disposal requirements than hazardous waste, solid waste, and liquid industrial waste. Medical waste should not be mixed with drugs. If you mix them, you're selecting the most costly disposal method. That's because there are additional handling requirements to deal with the infectious medical waste issue. There's also going to be a more limited set of disposal facilities that can handle the mixed waste. So if drugs are inadvertently mixed with medical waste and sent for disposal as a medical waste, the department would consider that improper disposal. In fact, in Michigan, if drug waste is sent for disposal as a medical waste, it's likely to go to an autoclave where it's treated under heat and pressure to kill the infectious agents, and then it'll go for landfilling. If that's what happens and pharmaceutical waste is mixed, it's likely to result in the medications being fumigated in the autoclave and potentially exposing the autoclave operator to medications in aerosol form. So the point is, today we're talking about pharmaceutical waste. And medical waste should generally be collected separate from drugs. If it's not, and you're mixing it, you should be prepared to pay the higher disposal expense associated with mixed waste. So this tutorial applies only to drugs, not medical waste. Note too that in some cases, it's not possible to collect drug waste separate from medical waste. For example, vaccinations with live or attenuated viruses preserved with thimerosal generally become a mixed medical waste or dual waste when it's disposed. It's subject to medical waste regulation due to the virus and hazardous waste regulation from the mercury in the thimerosal. For more information on what is and isn't a medical waste and how to handle it, you should go to our medical waste webpage, which is shown on your screen. Today, what we're looking to do is help all businesses that dispense medications. However, we're focused more on healthcare providers that generate relatively small amounts of pharmaceutical waste. Specifically, we're hoping to reach doctors' offices, veterinary clinics, outpatient clinics, and retail pharmacies, as well as home health care providers that dispense medication to residents. Larger facilities like hospitals with several hundred beds can benefit from the tutorial. However, they likely will want to look more closely at the different resources we have available to pick the different compliance options that meet their site-specific needs best. I'll discuss where you can go to get more resources and gain a better understanding of all the compliance options for managing pharmaceutical waste a little later in this tutorial when I get to the online resources section at the end. Today, we're advocating that smaller generators of pharmaceuticals commingle all waste pharmaceuticals, regardless of whether they're hazardous, non-hazardous, liquid, or solid, and manage them under streamlined standards for hazardous waste called the Universal Waste Standards. We're recommending this because it's by far the simplest way to manage waste pharmaceuticals in Michigan. The benefits from managing pharmaceuticals as a universal waste are many. They include that there's no need to test or produce data to prove a given pharmaceutical is non-hazardous, because ultimately you're presuming it's hazardous and managing it at higher levels. You don't need records to prove it's non-hazardous. You can generally store the waste up to a year, which is much longer than you can store it in most cases. The container labeling is easier because you don't have to list all of the hazardous waste codes that apply on your container. But the biggest benefit from managing them as a universal waste is that the weight of the drug waste doesn't have to be included in your site's monthly hazardous waste inventory. This, for many of the smaller facilities, will eliminate paperwork and can reduce your overall regulatory burden, since the more hazardous waste you generate, the more regulations you have to meet. If you look at the waste regulations, it only takes 2.2 pounds of acute hazardous waste pharmaceuticals in a month for a healthcare site to be subject to full regulation as a hazardous waste generator. The general handling and disposal requirements for universal waste are pretty simple. They require the universal waste generator to place drugs in a container that's compatible with the waste and will hold it, to separate incompatibles. They require them to maintain the container closed except when adding or removing waste, to label the container with the words universal waste pharmaceuticals, and to ship the waste to a universal waste handler or destination facility within a year, after making prior arrangements to confirm that they'll take it. Be sure you keep records to document the year requirements met, and simply date the container to help confirm that that's the case upon inspection. And also be sure to keep a record of your shipment to the universal waste handler or destination facility as proof that you're properly managing these wastes. In reviewing the universal waste regulations, it's important to note that spill cleanup from hazardous waste drugs can't be managed as a universal waste, nor can personal protective equipment contaminated with hazardous waste pharmaceuticals. That's because the universal waste standards only apply to pharmaceuticals. They do not apply to materials inadvertently impacted by them. So you have to handle those separately, and I'd recommend that you just manage those in conformance with the hazardous waste regulations and send them for hazardous waste disposal. Otherwise, you need to keep records to show that they're exempt and keep inventory information to show that you're a small generator to send them for non-hazardous disposal. We are also recommending that all pharmaceuticals be sent for incineration. This is because the incinerator destroys most all of the hazardous chemicals. The destruction efficiencies help prevent the pharmaceuticals from entering back into our environment and remaining intact and reaching our waters. So managing them as a universal waste and sending them for incineration may provide for managing them at a higher level, but it can reduce your regulatory burden while providing the least impact on our water resources. Commingling is generally expected to be the most cost-effective option for sites with smaller volumes of pharmaceuticals waste too, because of the decreased regulatory burden. The decreased burden from managing them as a universal waste is expected to offset the increased disposal expense. However, sites with larger volumes of pharmaceutical waste are better able to offset the increased costs in training, container management, drug labeling, record keeping, and handling with a more sizable reduction in the ultimate disposal costs. So commingling pharmaceutical waste and managing it as a universal waste is expected to be the simplest option and the most cost-effective option for smaller sources. If sent for incineration, then we have the best environmental option for preserving our water resources. Some examples of drugs that are hazardous waste include Coumadin or warfarin, arsenic trioxide, silver nitrate, nicotine, rubbing alcohol, epinephrine, phentermine, chlorohydrate. There's a whole long list of drugs that meet the definition of hazardous waste. Recall, about 15% of a pharmacy's inventory meets the definition of a hazardous waste. So you need to know which pharmaceuticals meet the definition of hazardous waste and which ones don't, and segregate them if you want to manage them in a different manner than just following the simple universal waste regulations. Here are examples of non-hazardous liquid pharmaceuticals. They would have to be managed as a liquid industrial waste, but could be managed as a universal waste with other hazardous waste drugs. In either case, you'd have to manifest the universal waste or the liquid industrial waste. The only other option you would have would be to use a trip log that's specifically authorized under the statute. But liquid industrial waste includes things like most of your IV fluids, non-hazardous liquid medications like Benadryl, Augmentin, amoxicillin, acetaminophen, and any drugs that don't meet the definition of hazardous waste and are solid can lawfully go in the regular trash. However, we're recommending that you incinerate them where possible. Any drugs in pill form that are not a listed or characteristic hazardous waste fall into being a non-hazardous solid waste. That includes the vast majority of the drugs like Zocor, Augmentin, amoxicillin, and acetaminophen. We talked quite a bit about medical waste earlier. Now we're talking here about mixed medical waste or dual waste examples. Mixed medical or dual waste includes your vaccinations that are preserved with mercury, creosols, and phenols if they contain live or attenuated viruses. It can also include needles that came into contact with listed hazardous waste drugs. For example, needles used in chemotherapy compounding would be subject to the mixed waste regulation in many cases. To determine exactly how they have to be managed, I recommend you talk to your disposal vendor. They can help clarify what regulations they're subject to. This chart is something to look at more closely a little later to get a better understanding of the common healthcare waste streams and the disposal methods envisioned by the MHA guide. It also shows you how the disposal method would impact our water resources. Note too that under hazardous waste incineration that 99.9999% of the stack exhaust emissions from a hazardous waste incinerator are going to be free of hazardous constituents. And the ash from the incinerator must go to a hazardous waste landfill who has control on the leachate that comes from that system. It has to be treated prior to ever being discharged to a water source. With that, I'd like to move on to how you can find more online resources. To find resources specific to healthcare, you should always start by going to the Waste Healthcare webpage. You can do that by typing www.michigan, spelled out michigan.gov/DEQ healthcare. All one word, no dots, no dashes. DEQ in your web browser. So in terms of resources to use, there will be different resources based on the strategy you want to use for managing your waste drugs. Your two options for managing them are generally to either commingle all drug waste so that you've got streamlined compliance requirements, or segregate your hazardous waste drugs from your non-hazardous liquid industrial waste and non-hazardous solid waste. Segregation generally appears to be more cost-effective for larger facilities. This slide outlines the resources that I recommend you look at to help you understand the requirements associated with the different options. If you want to commingle, I'd recommend going to the MHA guide, reviewing the introductory part, including the glossary, reviewing the universal waste guidance that I showed you with pharmaceutical section on page 19, and then reviewing the universal waste guide sheet. I think all of those combined will help give you a sound understanding on how to manage your universal waste pharmaceuticals. Keep in mind, if you have spill or impacted personal protective equipment with hazardous drugs, that has to be managed as a hazardous waste. Otherwise, you could manage it as a non-hazardous solid if there's no free liquids and you don't have a hazardous drug. If you'd like to segregate, I'd recommend reviewing the entire MHA guide, viewing the MHA guide webinar, and if there's any doubt as to how to properly manage things, viewing the 3 Introduction to Hazardous Waste series webinars. So, for wrapping things up, I wanted to highlight that the simplest approach for businesses in Michigan to manage drug waste is to commingle all drugs and manage them as a universal waste, ultimately sending them for incineration as a hazardous waste. This compliance approach is expected to collectively provide the least impact on our water resources. So we encourage you to do this because we can readily manage our drug waste inventories, but we can't readily and easily control excreted pharmaceuticals. To have sustainable water resources, we need to take action to try and sustain them for both current and future generations, and we encourage you to help us maintain that resource. With that, I hope you come away with a better general understanding of the environmental implications associated with pharmaceuticals and the resources you can use to determine your preferred management option. Thanks for your time and commitment to making Michigan a great place to live, work, and play. If you have more questions, please do call me or the Environmental Assistance Center for help. For additional information on pharmaceutical pollution and pharmaceutical regulations and the potential for changes in the future on pharmaceutical regulations, I recommend you take a look at the information at these links on your screen. Thanks again for your participation in viewing this webinar and for protecting Michigan's environment.